You must have all heard, had, or seen beverages with the tag diet, zero sugar, and sugar free. Now, do you really think that those drinks are healthy? Many people believe that switching from a regular sugary drink to a diet or a zero sugar beverage is healthier and will not damage your teeth. But sadly, that's far from the truth. Let's take a look at a few of the ingredients in these beverages, shall we? Carbonated water, primary ingredient, preservative, and it's got a super fizz which everyone loves. Now this fizz is going to allow that beverage to flow freely around the surfaces of your mouth and bathe your teeth in compounds that can damage tooth enamel. Then we have artificial sweeteners or non-nutritive sweeteners, aspartame, sucralose, as-sulfame potassium. These are some of the names that you will see. These sweeteners are 100 to 1,000 times sweeter than table sugar. It is reported that when you consume these on a frequent or a regular basis, eventually you land up with an adaptation whereby your sweet preferences are altered. So in the case of children who are exposed to these beverages, they will not be interested in eating healthier food that you offer them, like fruits or vegetables, because it's not going to match up to the intense sweetness of these non-nutritive sweeteners. Third thing, acids. Phosphoric acid, it is an acidifying agent that gives the tang to your cola. Citric acid, added in as a preservative. These acids, remember, lower the pH of your drink. Now, in the table above, you'll be able to see the pH of the normal few foods that we consume. If you look carefully, carbonated beverages are at the lower end of this pH scale, which essentially means they are highly acidic. So the lower the pH, the higher the acidity, the higher the risk for dental decay and tooth erosion. What have I missed? Caffeine. Caffeine is a diuretic, but unfortunately makes you more thirsty than when you started drinking it. Now, these kind of drinks have artificial or synthetic caffeine manufactured in a lab. So it is reported that this artificial caffeine has caffeine equivalent, or 1 teaspoon of this artificial caffeine is equivalent to caffeine present in 28 cups of coffee. Lastly, food additives to give color. So what then can we do to prevent damage happening to our teeth if we consume these beverages? First of all, hydrate, hydrate, hydrate. Please drink lots and lots of water before and after this beverage. Limit exposure time, which means sip on the drink as soon as you start and finish it in one sitting. Don't sip it over a few hours. When there is short exposure, it allows your saliva enough time to buffer these dangerous pH levels. Limit frequency, which means consuming these kind of drinks on a regular basis would definitely be a no-no. Also, wait for about 30 to 60 minutes before you rush off to brush your teeth. You see, I have patients who tell me, oh, I drank that and I immediately brushed my teeth. Why you shouldn't immediately brush your teeth is because your teeth have now been coated with acid or an acidic beverage, and it has already softened the enamel. So when you put your toothbrush to your teeth, you're probably increasing the damage to that enamel. So please give your saliva a chance to buffer to normal pH level. So wait for about 30 to 60 minutes before you brush. It is important to mention that people who have GERD, which is gastroesophageal reflux disease, or heartburn acid reflux disease, should really stay away from these beverages because their mouth is as it is in constant acidity. You really don't want to add fuel to the fire. And of course, remember that you should, if you consume these on a regular basis, visit your dentist every 4 months to check and make sure that there is no damage. If there is damage, it is small, it is repaired easily. It is much better than waiting for damage where, the dentist will tell you that really sorry, but we can't do anything with the way that your teeth are. So it is imperative to remember that just because it says diet or sugar-free, it's not always healthy.